Hello everyone, welcome to the second series of Urbanlogue. When we started the first series last year, we aimed to create a dialogue on an integral but often neglected topic, transport and its role in creating sustainable Indian cities. Today, as we all deal with the pandemic, it's crucial that we deal with it together. So thus, the format for today's discussion is largely conversational, addressing questions sent by you at the time of registration. We sincerely hope you find this session engaging and useful and take this forward in your work. On this note, a few housekeeping rules for everyone here. Participants and panelists feel free to chat and interact with each other in the chat box throughout the session. Type your questions, however, in the Q&A box. Our team will shortlist these questions for the Q&A session. And finally, if you like a question, you can also upvote it and it'll bring it to our attention. On that note, I'd like to introduce you to our moderator and speaker for this episode, Shreya Garapalli, South Asia Program Lead, ITDP. Over the last 2 decades, Shreya has guided the planning and design of public transport systems in over half a dozen cities in India. Her areas of expertise include design of non-motorized transport infrastructure, multimodal integration, parking management, and people and transit-oriented urban planning. Over to you now, Shreya. Thank you for joining, all of you.
Thanks a lot, Archana. So good afternoon, everyone. I'm very happy to have you all here today. Today is the first session, like Archana mentioned, of the Urbanlogue series, which is primarily meant as a guidance platform for city officials of how they could tackle the situation, the COVID situation, and how to create transportation systems which are COVID safe, but also we recreate a new future for transportation itself. Before I go further, let me introduce you to all the panelists that we have today. We would have an introduction by Mr. Kunal Kumar, the Mission Director and Joint Secretary of Smart Cities Mission at the Ministry of Housing and Urban Affairs. We also have a fairly big panel of, illustrious panel of speakers and panelists today with us. I'd like to first thank the Smart Cities Mission itself for all the support that it has provided to partner with us in launching this Urbanlogue's webinar series. A special thanks to Mr. Kunal Kumar and Mr. Rahul Kapoor and their entire team at the Smart Cities Mission. We are also happy to have the World Bank and GIZ as knowledge partners for this program. And we have today with us both Gerald Olivier, the lead transport specialist from the ICT and transport group at the World Bank, as well as Jürgen Baumann, who's the project director of the Smart SUT at GIZ, the Smart SUT program in India of GIZ. And he'll be co-moderating this session with me. In addition, I'd also like to thank Ms. Shikha. Today, she's the managing director of BMTC, the Bangalore Metropolitan Transport Corporation. And we are very happy that you could join with us today, despite the fact that you've again resumed operations of services of BMTC after a long hiatus. And we are very eager to hear from you how that's going and what your plans are going forward. We are also expecting Mr. D.P. Yadav, who's the Principal Secretary Transport Department of Tamil Nadu government. And in addition, we will
I'm there, Ms. Shreya. I'm there.
Great to have you, Mr. Yadav. Excellent. And we'd like to hear from you, sir, about what your plans are going forward with transportation in Tamil Nadu. And we are also expecting Mr. Sandeep Raizada, who's the General Manager of Operations at DIMS. They are one of the public transportation operators in Delhi, and to hear from them what they are planning to do. I'd like to now call upon Mr. Kunal Kumar to give a short introduction, after which we would have 3 presentations, one by me, one by Ms. Shikha, and then also one by Gerald, who's there with us. And thereafter, we would have a panel discussion and Q&A session. Over to you, Mr. Kunal Kumar.
Here and on Facebook, so it's been well received. I think it's a very important topic. We had a webinar with our cities in the morning where they had expressed concerns about private transport now easing into the cities, and public transport actually getting delayed and coming back as far as post-corona is concerned. And that was one of the concerns that cities were raising. So glad to have such a good panel. In fact, this is the first of 8 series of webinars that we're doing on this issue. And there is a lot of curiosity about it. I think, we see our role as a facilitator in the Smart Cities mission. So when we started talking to you, and of course the World Bank and the GIZ, and especially the ITDP team led by you, Shreya, and we thought there's a lot of value you can actually bring to the table and make our cities grapple with the situation they are in now better. So this is a fantastic opportunity for us to actually open up a good discussion and brainstorming and debate around how mass transit systems can come back to life, how we can actually reimagine them, how we can reimagine walking, cycling, public transport going forward, how can they become preferred modes of transport, and what are the things that have succeeded, and also more so what have not succeeded. And I think more learnings come from knowing about things which have not succeeded. And my request to the panel, and this, because it's the first webinar, I think going forward also, is to focus on the needs of the ecosystem. So my request also to cities will be that keep taking the panelists back on your needs. You can ask questions, you can ask them, look, this is what I'm facing as a problem. You have a panel which can answer all the questions. They have a lot of experience, a lot of expertise, and I think this is the best thing that we can do. And I'll tell the panel, this is one of the 7 or 8 different series of webinars we have started over the last few days. And the idea being that, we use this, and this has been an epiphany almost during the COVID times, that why was we not using this technology before the COVID crisis? We could have done so much more. So better late than never. So it's a good opportunity. So I thank the panel, and Shreya, I'll not take much of the time away from you and your panelists to make the presentation. And of course, I want a vibrant, interactive session. So my request to speak the cities and the officials and all stakeholders who are joining to make it a more meaningful discussion by rooting it to the problems on ground and how we can address them. Thank you so much, and over to you, Shreya, for the beginning of the webinar.
Thank you so much. Thank you so much. So I'll share my screen now and make the first presentation of the series. Now, Urbanlogs itself is meant to be a platform, a learning platform. It's not just a webinar, and we hope, like Mr. Kunal Kumar said, that this platform allows city officials to come to experts and also discuss between themselves. It's a peer-to-peer network where they can learn from each other and see what transformations that we can bring about. This series would have, to start with, 6 different webinars, but we could expand that. And we invite each one of you, the participants, and we've gotten phenomenal support, for this series. Just for this first session, you won't believe, nearly 900 people have registered, and we already have over 400 participants on Zoom. We also have many more participants on YouTube and Facebook as well who are listening in today for this session. The two big areas that we're looking at are COVID-safe public transportation and COVID-safe streets. And we would have these various sessions over the next few weeks, once every week. We would soon release a calendar of the webinars themselves. Let me jump into the issue itself. Now, what you see often is this on our streets. Our public transportation has been like this in the past, and there's no way we can let this be our future. Not just because we've had COVID, but even otherwise, but especially because of COVID, there's no way that this can be our future. So what should we do? We need to reimagine what transportation can be. Now, many people question whether people will be back to public transportation, if they will shift to private modes of transportation. And that's a valid concern that people have. But having said that, I'd like to show just this graph of how people traveled prior to COVID hitting us. And you see that nearly 70% of trips in Indian cities happened either on foot or on bicycle or on public transportation. Now, this might be an underestimate because a lot of trips are on informal public transportation in many of our cities, and they're not even properly counted when you look at it. And most people who are on public transportation are dependent on public transportation. Just today, I was looking at an article about how Many women travelers are having problems because public transportation is not available. And women especially are even more dependent on public transportation than men are in Indian cities. Now, if that's the case, what do we do next? I have a series of guidelines which ITDP, the Institute for Transportation and Development Policy, the India program of it, has created. And there are 4 key points that we're looking at as we resume operations. And there's one bonus point at the end that I'd like to speak about. These 4 are, first and foremost, our crew are very important. We must ensure their safety. Second, we must make sure that our buses are safe. Third, communicate with passengers actively so that they become your partners. And finally, ensure the safety of passengers when they use the public transportation system. Public transportation should not become a hotspot for COVID transmission. Now, when you look at the safety of staff, there are 4 key points. First of all, have a staff deployment schedule and communicate clearly to all the staff. Make sure that only healthy staff come into operations, come into work, because those who are sick must stay away from work. And I was speaking with Ms. Shika earlier, and she mentioned about how already over the last 1 week, they've been checking their staff for their health status. Now, they also need to have safety gear. This is a big concern. They are exposed to the COVID situation even more than many others. So we must make sure that they get the right gear, whether it's masks or how they use sanitizers and other gear, but also train them on how to use it properly for their own safety. And lastly, there are chances that they may get sick. Make sure that they have the healthcare and the insurance so that they are taken care of. When we take care of our team, our staff, they take care of everyone else. They are our frontline workers. Make sure that they're safe. Second, disinfect buses and terminals. We must clean every bus before every trip. We must disinfect, especially our terminals, every 2 to 3 hours. I'd say in a pinch, maybe at least twice a day, but we need to clean it. And in addition, we need to also make sure that we display this information at terminals and on buses so that it gains public trust. It's extremely important that people know that they are being taken care of. So put that. And finally, I'd say maybe consider installing sanitizer dispensers at terminals for public use. That's an additional point that you could consider. Third, communicate with passengers. Only when they know would they resume the use of public transportation. They should know what's operational. Use all possible media, whether it's newspapers or radio or social media or posters which are there so that the information goes out. Advise passengers to wear masks and sanitize their hands. Make sure at terminals that you're announcing information so that there is, crowding doesn't happen. And finally, look at encouraging officers to consider staggered working hours wherever it's possible. Promote alternatives like cycling, which is really coming up, and we'll speak about that in the future webinar sessions, but that's not the point of today's session. And lastly, of the 4 points, make sure that that passengers are safe. The first and foremost point, every single health professional will tell you right now, is no mask, no bus. Only passengers with masks must be allowed inside buses. And I think this must become our motto for the next many, many months, if not forever, that masks are essential. They're almost like helmets. And even when you wear a mask, you protect someone else. But for your own protection, you need to demand that of other passengers, that unless they wear a mask, they should not be on a bus. They should not be around public transportation infrastructure. The third point, which again is important, is to reduce the contact between staff and passengers. And so we should look at payment solutions which reduce contact. One of the key methods, and we will have another webinar dedicated to the payment solutions itself, but one of the key methods is you could deploy passes very, very easily. And again, BMTC is already doing this. They are considering looking at weekly passes, daily passes, monthly passes. That's one of our strong recommendations. Even before you look at various digital technologies, which you can in coming days, start with something fairly simple that you know, and make sure that people have affordable public transportation. And lastly, look at separation of buses for high-risk passengers versus other passengers. Like passengers like healthcare and sanitation workers, possibly you should run separate buses rather than combining them with other passengers in the city. Now, big elephant in the room is financial support for public transportation. None of this will be possible unless there is a strong support for public transportation. We need to look at it as a social good, and we need a strong stimulus package, if you will, on how our public transportation will not only survive but thrive and ensure that people get services. Do remember that most of our existing public transportation users are dependent on public transportation. They have no other option. Secondly, we cannot afford to have even more private vehicles on our streets than we already have. Our streets are already congested, and we know what the impact of that is. We've seen congested streets, choked air. We have serious health problems. We have safety issues, road safety issues, and we must use this opportunity to rethink what kind of a transportation we will create in the future. Again, the financial support question is a question that we will address in detail in a future webinar. This present webinar is not for that purpose, but we could discuss about it if some of you have questions about it. So I'd leave it with 4 points. First, state and national governments should treat public transportation as a social obligation. We must make sure that public transportation is available and high quality public transportation at that. If we want to maintain social distancing of some kind, and I'm not saying 50% occupancy or 30% occupancy right now, because I think that probably is not even possible in many places, but we cannot afford that first picture that you saw of crowded buses should be a thing of the past. It cannot be a thing in the future. Second, we can leverage various kinds of technologies to improve user experience, whether it's giving information out or using fare collection technologies, which can not only reduce the contact between the crew and the passengers, but also can be used for contact tracing. It can be useful for looking at passenger origin destination studies in the future to find out how people travel and provide services which are appropriate to them. Third, use the opportunity to professionalize informal transit services. One of the things that we do not acknowledge is that the majority of public transport trips in India still are on informal modes like share auto rickshaws, e-rickshaws, Grameen Sevas, and such. Now, they have been in doldrums, especially in the last 2 months. Use this opportunity to make sure that through financial assistance, but in turn also demand that they become part of a professionalized service using technology, whether it's fare collection technology or vehicle tracking technology that we have. And lastly, as a complementary measure, make sure that cities are expanding their walking and cycling measures, variety of which are possible. The next session is going to be on it. But it's essential that we look at transportation as a holistic ecosystem and make sure that our cities are great places to be for all citizens, not just for a few. If you want to learn more, you can go to this link where there's more detailed guidance on the issue of how to resume public transportation operations. This guide is available already online, and we'll also give you the presentation for future, and we'll share the link with you. Thank you very much. So that was just a quick introduction into this issue. I'd like to next give the chance for Ms. Shikha. She's spared some time for us, and I'd like to make sure that before she's called into some other emergency, that she could speak with us. So over to you, Ms. Shikha, for your presentation on what is it that you're doing in Bangalore with the MTC services resumption. Thank you.
Good afternoon, everyone. Thank you for having me over for this webinar. I'm very glad to share the experience of BMTC on this forum. BMTC stopped operating immediately after a post-lockdown period, and during lockdown period, we were only running our essential services. Pre-lockdown period, our capacity used to be, we had a fleet of 6,000, we have a bus fleet of 6,500, and we are carrying around 35 lakh passengers per day. Immediately after lockdown, our operations had stopped, but our health services and other essential services continued. So we continued to provide health services for the people who had to travel to hospitals, the health workers, doctors, nurses. For them, we had provided special buses, and the routes were also customized to cater to their needs. At the same time, there was various evacuation programs going on by Government of India, Government of Karnataka, and we assisted government in that also. So 250 buses were provided for mobility of more than 21,000 stranded labor who had gotten stranded here in Karnataka post-lockdown. And In the first window, as I said, post-lockdown, we operated only health services. In the second window, after second lockdown, we started our essential services also to Vidhan Soda, which is our secretariat, and for government employees, banking officials, the essential services. That services also we started after a short break. Next, please. So we had put a lot of safeguard measures in place before starting operations. We constituted a strategic working group for epidemic prevention and control, and we had a very good standard operating procedure for post-lockdown operations. So we had developed this SOP that what one should do in all the depots, how the buses should be cleaned, and how the offices should be maintained, how the terminals and bus stops should be maintained. So this a detailed SOP was put in place well in advance, because we were expecting to start our operations post-lockdown 3. So we had made these SOPs well in time and communicated to all our officials and staff who had to implement it. And we had also ensured that all our crew are properly trained regarding this. So this training started well back in February itself, and the health department themselves came forward to each and every one of our depots and trained our crew personally regarding do's and don'ts about coronavirus. And similar things were done for our bus users also. And we had a frequent communication mechanism with our users through our media channels, through social media. I was also handling the social media task force for the state for COVID-19. So in a sense, whatever material we were creating, we were ensuring that it is passed on to all our BMTC crew and all our users. And secondly, we post-lockdown, post and start of operations, we had also planned out what would be our fare collection mechanism. As Shreya said, it was very easy to start off with bus passes immediately. We already had monthly and daily passes. The only thing we introduced is we introduced something called a weekly pass also, so that people who could not afford to buy a monthly pass could still buy a weekly pass, and this reduced the number of contact one has to have with the conductor. Next, please. So these are the measures which we had taken up for safety of passengers. So I'm sure that all the STUs, because we have our own WhatsApp group of various STUs heads, and all the STUs are doing this very diligently. We are frequently sanitizing our buses and premises, and we are following the standard operating procedure and the protocol to clean it. All the touch points are disinfected daily and sensitized daily. And we are also maintaining the social distancing aspect in the buses. We are currently carrying roughly 50% of our seating capacity, but this may be difficult. Today was the first day of our normal operations. We started operating, the AMTC started operating today as per government directions yesterday. And today we maintained 50% of capacity. Since today the number of passengers was quite less, because they would not be well aware of the routes we would be operating, and they may also be having some hesitation about public transport, which we have to set to rest. So today, since the number of passengers was less, it was easy to carry only 50% of our capacity. But this in long term would be a big challenge for STUs. What I propose would be ideal is no standee policy, because it is basically because of standees who lose their balance and have to keep touching various touch points, and that there is fear of spread. But if one is seated in a two-seater, if two people are sitting in a two-seater with adequate distance between because of the aisle, I think that should do for Indian circumstances. But obviously it is up to government to decide about this. And we have also enforced that there is compulsory boarding from the rear door and alighting from the front door, so that again people onboarding and alighting don't mix up with each other. And we have provided hand sanitizer also for our crew as well as for the people who are using the buses. And mask has been made very essential. In fact, our local city corporation has levied a fine on people who don't wear mask, and that is being implemented diligently by BMTC also. So today we didn't allow people who were not wearing mask onto the buses. Next, please. And coming to more important point, that is safety of our crew. There would be a lot of confusion, lot of dilemma in the minds of our crew, because this is a phase in which we are going through, which was unknown for before this started. So what we have done is, since our staff had gone out of the city during the lockdown period, Once they came back, we ensured that all of them undergo a health checkup. This was both for their confidence building also, as well as for our commuters, that the day-to-day staff they are interacting with have undergone a health checkup. And we are also doing their daily thermal scanning, their temperature check in the depots every day before a bus is allotted to them for duty. We do we have allotted a thermal scanners to each depot. Their thermal check is done every day. The necessary personal protective equipments have been allotted to them. They are all wearing masks, and conductor is wearing gloves. And we have also provided this face shield to the conductors so that it is a double kind of protection for them. These are some of the steps which we have taken. And during the lockdown period, those staff crew members who had voluntarily come forward for providing these health facilities and running these essential services, we have given a special incentive and special allowance for them for standing up with us during the time of crisis. And we have also trained our crew in crowd management and in telling them to sensitize the users, the commuters, about the entry point, the exit point, the compulsory wearing of masks. These things are being taken care by our conductors. And during the lockdown period, we also did online yoga sessions for our crew to keep them engaged and to keep them motivated. Next, please. And then we also have a lot of communication and outreach campaigns both inside and outside our buses. In our all terminals, we have information displays which are very dynamic and which keep changing. As soon as a new government order is issued or new circular is issued, we update in same in our bus stations. Awareness material has also been pasted inside and outside buses. Inside buses basically on the use of masks, because people sometimes don't cover their nose and mouth properly. So how to use a mask, how to clean it, how to wash it, and how to dry it, and how to reuse it, how to remove it. All these things we have displayed inside our main theme is one is wearing of mask, and second is social distancing. These are the two themes based on which we have prepared sufficient awareness material and displayed it inside the buses as well as outside the buses. And we are also playing COVID-19 awareness audios in our bus station so that commuters are aware of do's and don'ts during this period. And all the masks and gloves which are worn by the conductors daily are disposed of in a particular manner following all the protocol. So safe disposal is also something which we have kept in mind. And as I have already said, the Health and Family Welfare Department of Government of Karnataka themselves came to our depot and trained all our crew, because of which there are a lot of things which our crew are also well aware of. Next, please. And fare collection is a very important aspect which STUs have to handle now. What I suggest is to begin with immediately passes is something which reduces and minimizes the contact. It may not eliminate it, but it certainly minimizes the contact. And this is something which we have started today. Today's BMTC's operation policy was no tickets allowed. We allowed only bus passes and QR code scanning. We have provided for QR codes on 75 buses on pilot basis. And if everything comes through fine, we are going to escalate it to all services by this month end. So no ticket policy is what BMTC is following till the end of 31st of May, and in days to come we will try to see how to take it forward. And during this time, as we had also announced, there's something called bus priority lane which we had planned along with our BBMP. It's a 22-kilometer stretch which work was also going on, and this was something unique because with minimal cost this could be done. This is a 6-lane in which one lane was dedicated to buses, and we started our operation on this route also today because it came into effect during the lockdown period, and we are planning to take it forward. And we have been able to save a crucial time because this used to be a very congested route, and after the BPL is implemented, we are able to save every day up to 20 to 25 minutes of time in this lane. So these are some of the measures which BMTC has taken, but obviously financial constraint is something which we are already facing. There's a huge financial loss of revenue during the lockdown period, and now also as gradually we are limping back to normalcy, our graded coming back to operations is also going to cause a lot of financial inconvenience to us, and we hope that government comes forward to assist us in such crucial moment. Thank you very much.
Thanks a lot. Over to you, Gerald, for a presentation on the COVID Green Label.
Okay, great. Thank you, Shreya. I want to also thank Mr. Kunal Kumar from the Smart City Mission for organizing this series. Personally, I've been listening a lot to the previous series of Urbanlogue, finding it very interesting. So it's a pleasure to be associated with ITDP and GIZ and obviously the Smart City Mission as part of this next phase of Urbanlogue. You know, I think I want to start by making an important comment in my view, which is that what happens in the next 2 months and the next year is going to define the way people perceive public transport, not only for that period, but for what comes next over the next decade. We know that public transport in India is at the point where a lot needs to be done to really create and deliver a system that answers to people's need. And the way the system responds will really define a lot of it. So next, please. What I would like to do is to build on the presentation Shreya made and the thoughts shared by Mishikla on the implementation in BMTC to think about, okay, so we have a number of STUs that are putting in place you know, a good set of SOPs and training their staff and making improvement. But the ecosystem of public transport in India is very, very large. You have, aside from the STUs, you have about 15,000 operators that are active. So how do you create a system that altogether is going to equally deliver on the quality of service? So we discussed about the need for a potential COVID green label. These are concepts, so you know it's also welcoming feedback as to the suitability. The focus would be on buses, IPTs, and shared ride, with a focus on how do you create not only the SOPs and the training, but you validate that this is being implemented over the long run, because that's really the challenge. And how do you create a feedback loop with the private sector, with the public, to know that this is happening the way it should be. I will touch upon at the end on digital ticketing. Next, please. So, I mean, first, the need for a COVID green label. I think it's fair to say that quite a number of people are going to be concerned over, you know, whether the buses are safe. Employees are going to be concerned over driving a bus or being a conductor in a bus is safe. And there is certainly a need to communicate to ensure that trust is built or restored vis-a-vis public transport compared to other private modes of transportation. Otherwise, in 6 months, you will have a lot of people who will have bought two-wheelers and that would have moved away from public transport. So we see COVID Green Label as a voluntary certifying process through which a transport operator like BMTC, but also any private bus operator could qualify by meeting certain criteria that I will lay out after, which would then allow them to communicate both with staff and with passengers that they are you know, making the right efforts to ensure their safety. Next. So these are the three subsectors where we are looking at as a potential target for the COVID Green Label. Next, please. At the core of what we see emerge from international practice as well as practice in India, we see the need for a dedicated multi-department workforce that is really focused on, you know, putting in place the rules, monitoring the implementation, ensuring that training of staff is taking place. So that's the first pillar. The second deals with ensuring that the proper standard operating procedures associated with and the associated training takes place so that people know what they have to do in a range of circumstances, and that range may evolve over time. So it's a very dynamic process. Third is a set of cleanliness and hygiene measures that Shreya described in her presentation. Next is the set of measures required to ensure physical distancing in buses, in line with you know, requirements from the government, essentially, but also keeping in mind the level of risk to which staff and passengers are exposed. Next is the rapid transition towards cashless ticketing, be it both e-ticketing as well as passes, as was mentioned in the case of Bangalore. And last, the need for a functional communication strategy. So next, please. The idea is to accordingly go through a process that prepare a set of tools across those six dimensions systematically, conduct a certification that those elements are in place, and ensure monitoring through third party and passengers about the compliance with those systems in place, so as to rebuild trust. And for those who are meeting those criteria, maybe provide support so that they can gain further than just providing a safer environment to their passengers. Next, please. So the preparation obviously needs to recognize that across the three subsectors I mentioned, IPTs, buses, shared ride, you're going to have very different set of SOPs that will be applicable, but also within India, you're going to have differences that are quite notable. But there is a common core that needs to be applied across. And what we suggest is to create essentially a template to look at the critical elements that need to be in place regardless of where you are in the country, and then validate that those are in place as part of this preparation, and to develop the training modules that come with it. Next, please. The second part is the certification. And the certification is really a process that starts with the operator itself, doing their own due diligence, their own capacity building, and documenting what's happening, but also the need for a third party to review what has been done so as to issue a label of this kind. And the idea would be to, based on what was developed during step one, to validate that the minimum score is being met for getting the certification. Next, please. So as part of it will be a need to monitor the implementation. And that's maybe the most challenging part in every system. It's easy to put SOP in place. It's easy to keep them in place for the first week. And what happens in week 4, month 4 becomes much more challenging. So that monitoring that allows both internally and through third-party monitor to see what's happening would be an important element. But as part of a rebuilding trust, we see also the opportunity to bring facilities that allow passengers to rate the way COVID is being implemented in their system. We see that the government has not yet come forth with a very clear financing program to support the public transport industries. But if they do so, it would make sense that only those that have achieved a COVID green compliance level be supported. Next, please. So when you look at who could be potentially certifying and monitoring authorities, there are a number of options. And this is what we are discussing at this stage with the public and private operators, who is the most suitable to both certify and monitor. One of the options in particular for long-term sustainability is to create a partnership between the operator, the IT platform that they use for tracking buses, issuing tickets, and rating their services. Third, a third-party reviewer that would be validating that what they said they have in place is actually in place. The public authority to verify what's happening with the certifying authority, and at the very center, the public to indicate deviation as they may occur. Next, please. So, among all the measures that Shreya mentioned, one of the important opportunity to think about is a shift towards digital ticketing. Next, please. We have a need that is quite unique today to understand, first to reduce the physical currency exchange risk so the touching of money, etc., that could spread the virus, and reducing the contact with conductor as much as possible, the physical contact. But there is also, for travelers, a need to be able to be informed if something has happened that warrants their follow-up information. So, you know, the ability to trace and communicate any such occurrence is very important and can come only with digital platform. Next, please. We see a number of opportunities to accelerate digital payment platform. There are obviously a number of solutions that range from QR code, and I think BMTC just have introduced QR codes in all their buses. There are mobile tickets and passes that can be provided on a proprietary or third-party app. Those characteristics will be reviewed into future session where we go in details into payment modalities, but they come with their own characteristics in terms of how fast they operate, how much complexity is associated with replenishing the account behind it. Next, please. We also know, obviously, that the closed loop card have been in action for quite a while in India. There may be an opportunity to accelerate the use of them in the interim in order to reduce the number of cash transactions. Although in the long term, open loop cards following the NCMC system are still the way forward. One thing about mobility as a service as a long-term option. Next, please. As part of this shift is the opportunity to rethink about the customer at the center, providing solutions that really become more responsive, right? So it's not only about COVID green label, it's about rethinking about where you want to be as an industry and create solutions that are going to then scale towards the direction you're aiming at in terms of, you know, being able to have multimodality, interacting with the passenger, targeting subsidies for some passengers that may warrant it, but also driving your overall operational efficiency as operators by reducing costs and having a better understanding of people's behavior within your system to optimize essentially your service delivery. So we see actually outside India that a lot of the shift towards digital payment has also been part of a strategic approach to make the sector more bankable, because it creates a traceability that is attractive for commercial banks to support such system. So last slide, please. What we are looking at present is we are interacting with each software or payment as a solution platform in India, trying to understand what is available and what could be a path to rapidly accelerate the implementation of e-payment solution. That, you know, includes obviously QR code that could be done very, very rapidly, and then gradually all the way to NFC-enabled bank cards and mobile payment as part of the phase 2. So we'll go into a lot of details on those aspects in future session, but this is really part of how you create the ecosystem that creates the accountability, that creates a system for feedback on a COVID green label that I wanted to mention. Thank you. Back to you, Shreya.
Thanks a lot, Gerald, for the presentation. So we've had two great presentations from Ms. Shikha and Gerald, and I hope you found the introduction that I presented was also useful. So as the next step, what I'd like to do is, I'd like to invite my co-moderator, Jürgen, to maybe have an initial set of reflections and ask a question of one of the panelists. Jürgen, over to you.
Yes, thank you, Shreya. Thank you for inviting us also to participate and to support this webinar, which is a great initiative from the MOHUA. As per the Government of India order, the third complete lockdown, which was declared due to the ongoing COVID-19 crisis, came to an end this week. The lockdown has been lifted partially at few regions with strict guidelines from the respective state governments. Few of the cities and states are intending to resume some economic and other essential services based on which various offices, establishments, commercial areas, public spaces, and others will be operational. As a consequence, various modes of transport to move people will also resume. And this is mainly in the urban areas, but it's also the connection between the urban areas and the rural areas. So cities are on the front lines of the pandemic and are facing significant challenges, such as how to provide reliable transportation for commuters while promoting public safety. Cities like New York, Bogota, Milan, and Berlin are turning to cycling as a resilient and reliable option to fill the gap. And we have already had the announcement from Shreya that there will be more webinars addressing also this topic. Cities have started to reclaim streets by widening the footpaths and installing temporary infrastructure for cycling. However, for cities in India, public transport will continue to be the most favored mode of transport due to various reasons. Hence, it is essential that decision makers, service providers, and operators consider safety and health of the passengers and staff involved in the service as a prime area of focus. Keeping this in mind, various standard operating procedures, action plans, and recommendations play a very important role for operating various bus systems post-lockdown. I have a question for the beginning, which is related to the safety and the question how an operator can act. So this is especially to Ms. Shika. Do you get sufficient information about the expected demand for transport services? Can you provide sufficient staff to ensure at the bus stops that there are no conflicts if the bus cannot take on more passengers? Having only 50% capacity, we need to expect that many people have to wait quite a long time when they approach the bus stop.
To begin with, today we did not find it difficult to restrict to 50% because the number of passengers itself was less as expected. We are opening after a long lockdown of around 55 days. What I realize is during this intervening period, people have been sufficiently sensitized about the issue of maintaining social distancing in their own interest of their own safety. Today, in fact, when our conductor tried to tell people not to sit on the same seat, they obliged. So today, when the number of ridership is quite low, it is not an issue. But yes, in days to come, there could be a protest saying that if the bus is going almost half vacant, why they should not be allowed to board it, why they should be waiting for more buses. So what protocol we had followed is that we had put a team on line check to see where there was more crowd, and we tried to send more buses to that route. But then obviously it's not a sustainable operation. We have to go on to digital, where people can know what are the number of seats booked in the next bus, and then how long they will have to wait for a bus. These are some of the digital initiatives. We can scrape through with manual initiatives for maybe a few weeks, but in days to come, when the ridership increases, some kind of digital initiative for people to let them know that what would be their bus waiting time, what would be the ridership, the passenger strength in the next bus would be something which every STU will have to think of.
Thanks a lot, Shika. May I ask a question of, I'd like to invite Mr. Dharmendra Yadav. He's the Principal Secretary of Transport Department of the Government of Tamil Nadu. Maybe would you have some reflections on what you heard from the speakers, and also share some thoughts on what the Tamil Nadu government is planning to do as it starts preparing to resume bus operations across the state. I'd like to mention that Tamil Nadu and in general the southern states of India have been more at the forefront of public transportation itself historically, and that's why we have two senior officers from the governments of Tamil Nadu and Karnataka present ideas today. We only have about 30 to 35,000 urban buses, of which a very large chunk, more than 50% of those buses are in Tamil Nadu and Karnataka alone, of the urban public buses that we have in operation.
Thank you, Ms. Shreya, and all the panelists and participants. Yeah, I had been listening to the whole deliberation, and then otherwise also a lot of SOPs had been circulated from different parts of the world and different organizations. And of course, we are living with the COVID for almost 2 years and handling the situation. I will only say that we should not be too overly concerned about this virus and learn how to live with this. And basically, the precautions are very, very critical to it, and management of it, along with the, some like other interventions from the health department side. Immediately, we could not understand the disease and its impact, but over a period of time, we will be able to. So, to start with, we have also issued some SOPs in our buses for physical distancing. Generally, the word used, social distancing, is very, very like basically I'll say that it's the physical distancing which is the more critical than the social distancing. We can't do social distancing. So we have issued SOPs for that, but over a period of time, as Shikha said, we will ensure that we are going to put dispensers, like hand sanitizer dispensers in all the buses on the both the gates, and then everybody will be definitely he will be sprayed with some, like in his hand he will take sanitizer, and then crew members will ensure that, and then necessarily he has to wear the mask. At every trip we will be disinfecting the bus too. With this, I think not immediately, of course, because there is a lot of concern and other things. Even today also, when we had been operating buses only for the government staff, government employees, so there had been complaints that okay, there has been too much of crowd and social distancing has not been followed, is what the many of the people said. And then we have improved. Yesterday it was yesterday, and today we increased the number of buses, because initially we are not knowing how many, because from 30% it became 50%. But then over a period of time, if people have mask and hand sanitizer, and they know that what is the disease and how does it spread, and when they are traveling out, they should not touch their face and other things and all. If they do, before that, they should use a hand sanitizer and all. So if that happens, I don't think that should become a problem, and we'll start living with like, okay, physical touching does not really lead to infection unless you touch some surface and then come to your face or something like that. So that is one, this thing. And then because with, I think 30 to 40% of the occupancy, the number of buses required during the peak hours, I do not know how much it will be. Like I'm running in Chennai, let's say 3,300 buses, and peak hours, you know how the situation is. And even if we double it, it will not be sufficient. I was just calculating that we were discussing about examinations which are going to happen for the 12th standard by the state board. And then we are calculating, suppose we have to provide the buses to bring the students alone, like students alone through some route and other things and all, putting so many students in a bus. We have got only 20,000 buses available with us across all STUs put together, and that will be not sufficient to transport all the students with this seating kind of a thing. Forget about like the whole entire population, where in Tamil Nadu 1.62 to 63 crore people travel every day. So definitely that is a big challenge, and even if we hire the buses from private operators and do that, again it will be a challenge, financial as well as immediate challenge of getting that many buses is also an issue. So these are the critical things. So let us see as the things unfold. Probably we will see how we respond to how much of more buses are required with this kind of a norm, and whether we can sustain this norm over a period of time, and whether this norm is essentially required to be maintained that way, or like with the sanitizers and masks, people can sit next to next. So that's one. Then, of course, cashless transactions are very, very critical. We are also looking at that, how to handle that. We have been talking to various organizations because we are having pass system, of course. So the monthly passes are available, and Shikha has introduced weekly passes. I read today, and then I think we'll also try to introduce. I was saying day passes and weekly passes, but again, like cost of the passes and the way of distribution and other things are there. So that also we'll see. I think weekly passes may work out, but daily passes or daily something coupon kind of a thing, we can also look at QR code coupons, which can be like people can buy in bulk and then use it every time they go to the bus. That can be one solution we had been looking at. And long-term solutions also, this we want to divide the whole e-ticketing into hardware and software part of it, and procure the hardware immediately, so that various modes which don't require third-party validation can be done if the the QR codes are there or closed loop cards are there. So if there is a reader, then they can be immediately, we can start using that if we can procure this thing. So we are working on this, but everything requires a tender and then procurement of it, and time to procure. Of course, the numbers are not very great, and these instruments are available off the shelf probably, or can be assembled also very fast. That's the thing. And I will also say that one, like basically we are into stress. So similarly, recently the government of India came out with this transmission and generation companies have been provided with some fund of 90,000 crore as a fund to take a loan or whatever, like giving loan at a concessional terms. Similarly, for the transport corporations also, immediately we are having problems of payment of salaries and all. I had been negotiating with the banks, and right now, like we have gone with SBI for some 1,200 crores, and but that may not solve the problem in the time to come. We will be needing for the funds. So if at a concessional rate, at a much cheaper rate, some transport fund is also created, the way that this like electricity, in power, there is such kind of a finance mechanism. So these NBFCs in the transport sector too may be provided this kind of a funding mechanism where they get the funding at a cheaper rate. And then World Bank had been working on this NBRP. So if it is again like rolled out faster, so that again can help us in the form of VGF funding, as well as contracting of the buses can be expedited, and some kind of support on those can be obtained. So this is all I will, that's what I will say, and will like to be further enlightened by all other members who want to contribute, who will contribute. Thank you.
Thank you so much. Thank you so much. You know, I take that cue and maybe ask a question of Mr. Kunal Kumar. If you think that it's possible to have a national level program for financial assistance to public transportation, like how can public transportation be seen as a social obligation where there is public support for all the benefits that it creates otherwise? Because we cannot afford at this moment to get people to move towards private motor vehicles anymore. A recession which is potentially going to happen, or we are already in a recession, would mean that many people may not actually have the means to afford a more expensive private motor vehicle, which means that they might be more dependent on public transportation for their travel needs. What can we do to make sure that people's mobility is ensured in such a situation?
Well, I'll be humble enough to, I would not have the complete answer, because there's, just like in a hospital, a cardiologist can only answer for the cardiology section, the orthopedic can answer for the orthopedic section. I may not be the right person to talk about the entire hospital, but yes, I'm aware of the problem. And being aware of the problem itself is not enough. So I think, institutions like yours and institutions like others in the world, if we can really construct the problem well, in the sense of its mathematics, how much it has hit the industry, what is the kind of support that public transport institutions and STUs and BMTCs and PMPMLs of the world need. If you can really come out with the mathematics, it'll really help put the agenda at the forefront, because people, they know that there's a problem, and there's, by the way, problem everywhere in COVID. So how do you actually pinpoint on this? So this is one fundamental thing I want your help on. The second thing I think is, this is the best time to talk about alternate sources of finance. Time and again, we've seen that, sustainable transport, yes, social obligation, yes. But, at this juncture, when the government is fighting the disease in so many different frontiers, you see, unfortunately, what happens is you see further tightening. Instead of seeing more liberal ways of, releasing money in the market, you will see further tightening, because, government resources get constrained and all, and the money that we all think of should come doesn't come. And there are multiple priorities, and look, each of them will say that this is as important as the other. So I think alternate sources of finance which have never been explored in our country, for example, carbon tax, for example, parking, for example, the money that can come in from transit-oriented development, for example, the money that can come in from multiple different other, ways of doing this, vehicle ownership tax or whatever. I know these are not really good to sound and not make any political, mileage. But I think this is the time when the government is going all out and taking bold decisions. But the problem is, talking about them is not enough. And somehow the translation doesn't happen. One knows what carbon tax is, but doesn't translate on ground, because this whole process of going through that. So if one state, one city, or maybe one part of the country can be actually taken through that quickly, then it becomes an exemplar for other places. I was in Pune as a municipal commissioner. I know that all the parking mathematics that we had done showed that we could get around 200 crores per city, which is 200 million rupees, 2,000 million rupees per city in the city like Pune per month. And so that could have easily, financed my public transport. So I'm not saying that government should not look into it. I know that government will look into it, and we will, in this webinar, and if you can help me with the numbers, we will push for it. But I think time has come that we push the agenda on alternate sources of finance really hard and get a breakthrough at this moment. I think Urban Transport Fund has remained on paper. Urban Transport Fund has to actually get actualized by these kinds of alternate transportation, alternate ways of financing public transportation in cities. This is my thought here. Yeah.
Thanks a lot. Thanks a lot for your thoughts. Just to further the ideas that you've put forth, parking itself, our own calculations at ITP India program suggests that for a city of 1 million, you can easily get about $10 million equivalent, or about 70 crore rupees per annum from parking charges alone. This is net off all costs, which means if there is a city like Chennai, which has 10 million people, or Bangalore, which is also about 10 million, you could easily get about $100 million every year. And that should be more than sufficient to make sure that public transportation can stay affordable, and we can dramatically increase the bus fleet that we have in these cities. Also, just to point out, London just now has announced an increase in its congestion price charge. It's up to £15 right now. And the government has now intended, very clearly said that they do not want to have more congestion, and instead would like to have more people travel by public transportation, and they're dramatically increasing their cycling network as well in the city. So I think we really need to think about these forms of financing, and how do we make sure that maybe some of the self-sufficiency can happen at the city level itself, but maybe there's also something to be done by the state and the national levels. So I'd like to ask Jürgen again, if you have a question for maybe Gerald. He was one of the speakers, but in addition to being an expert, he also represents, at the end of the day, a bank which has money. So
yes. Yes, of course. Looking at the World Bank homepage, they say that they have set up a fast tracking to financing COVID-19 response efforts. And I would like to ask Gerald, what does the fast track means in time, and how much money is planned for India? We know all that not only the World Bank, also the other MDBs in the world, it always takes quite a long time. They are willing to give money, but they are banks, so there are certain procedures they have to keep. And I'm wondering, fast track. This would be really interesting to learn about what does that mean in responding COVID-19 challenges. And of course, I would be interested to get his answer to the ideas from Mohua about the Urban Mobility Fund.
Okay, thank you, Jürgen. Let me start by saying that the past 2 months have been quite exceptional in terms of the way we have been, given an opportunity to work with the Indian government in terms of providing support with respect to COVID. I mean, the first set of support really came as part of an emergency response for the health system preparedness in early April, where in a matter of 10 days, $1 billion was put together. Of course, it built on a lot of studies that had been done in prior years, but the urgency of the moment meant that it was time to, scale up the testing capability of the country, create isolation wards, look at infection prevention and control. So all of this got packaged into a first investment project in a matter of really literally 10 days, and was approved and is being disbursed over a 3-month period. The second one was approved actually last Thursday, and it looks at a second part that is quite essential in the COVID response, which is social protection. We know of the many migrants and poorer part of the population living on $3 a day in India that have really been left with very, very little to survive. So that second project is also about $1 billion in 2 phases, 750 this year and 250 next year. And it really looks at scaling up the cash transfers and food benefits that come to the people who are the poorest in the country. So we call it fast track in the sense that a typical bank project would be a 12-month cycle. This one were a matter of weeks in terms of being prepared, delivered, and rolled out, because it built on country system that were then expanded and tweaked, for example, combining the different system of public distribution and direct benefit transfers, and combining them in a way that makes it more effective. Now, when it comes to the question at play today, public transport, I think it's certainly a sector that is going through a very deep crisis. Like, a little bit like the hotel and restoration business. It's a business where revenue is totally gone. Your fixed cost of staffing is still there. So all you save is a little bit of fuel that you have not used during the lockdown, but therefore you have a huge financial gap. Whether you're an STU or you're private operators, it's true throughout. But even as you restart today, you're going to still have, companies that traditionally are not making money, and suddenly their revenue base is divided by 2, right? So this is a big gap that comes as part of the physical distancing, as PS Transport from Tamil Nadu mentioned earlier. So that in and of itself is a big gap, but it's important to think about phases, right? Today we are just coming out from the post-lockdown. Then you're going to have 2-3 months where traffic resumes at different pace across the country. So some places will go very fast, some will take longer to resume fully their activity. And then you're still going to have a second phase of recovery where then your supply may not be sufficient to deal with the demand due to physical distancing, where we need to find solution. And then you have a longer term, new normal that will be balancing things out maybe a year down the road. So how do you deal with that survival of the sector, and keeping India moving during that period becomes quite essential. And that's where certainly I think the notion of thinking about alternate source of finance comes to the forefront, right? I mean, there's no secret that the government, like others, does not have very big, deep pocket at this point, given you know, the shortage of tax collection that has taken place. So how do you create new sources? I would say that in that context, we see other countries are working with companies, and companies are footing part of the bill to make sure that their employees can safely arrive to their working place. And you know, in a country like mine, I come from France, about a third of public transport costs is actually covered by companies through a tax on turnover that is being charged. Now, this is quite interesting as a concept because it leads us to a, you know, who benefits pay type of thing, but the beneficiary being the company being able to access more staff and the like. So that's one of the solutions. The second one is to think about the recent increase in the cess on fuel that took place last week. And we think about how do you leverage that cess increase into a fund that could support more support to the stability of the sector or multiple sectors. So this is collected by the Central Road and Infrastructure Fund. So those kind of modalities is what will give you the scale you need to deal with the huge gap that you can expect moving forward. Now, of course, you know, banks like ourselves are looking across all sectors, and there are certainly a lot of priorities, and we are looking at both the short term, what could be done, and what could be done short term and what could be done in the new normal. We had been discussing, as was mentioned earlier, about a potential national bus rejuvenation program that would scale up the insufficient supply in cities using you know, very innovative mechanism of delivery. I think there may be a need for a phase zero that stabilize first the sector, ensure that it operates safely, you know, with COVID responsive measures, but it does operate, and you know, let it transition through the next phase, building the system to squeeze efficiencies. Now, there's one more thing I would like to say, that ultimately a crisis like that gives you an opportunity to accelerate some of the transformation that makes the system more efficient. Ms. Chika mentioned, for example, the use of a bus dedicated lane, right? This is, I mean, the number of kilometers you can do per day in a bus has a huge impact on your cost of operation for that bus, right? So if you can create infrastructure of this kind that reduce the cost per kilometer of your buses, you generate some savings that can be applied towards the decreased revenues you get from you know, the social distancing. You also can use ITS platform to optimize the match between supply and demand, and that's something that is going to be much more required today, given the dynamic environment we are in, compared to what you were doing before. So these are some of the thought that we have in mind. I just would like to maybe also mention, last but not least, that yes, go ahead.
You know, we have a lot of questions from our audience as well. We've had phenomenal support. We had more than nearly about 900 registrants and about 600 participants today, some on Zoom.
Great.
And others on YouTube and Facebook. I think we have some glitches on YouTube, but Facebook as well. And we have a lot of questions coming in. And our goal of Urbanlogs is to make sure that this is interactive, that we make sure that our participants are very much real participants. So I'd like to take a few questions from the participants then. Is that okay with the rest of the panelists? I'd also like to mention that, you know, we had initially slotted this for, we had initially slotted this session for 75 minutes. We're already through with 75, but we'd like to extend this by another 15 to 20 minutes so that we can actually take questions from the audience, from the participants. First question that I'd like to ask, you know, from the audience also is the question about private buses and informal transit. Now, as we can see in Tamil Nadu itself, while Chennai might primarily be running on buses, we also have a large number of share auto rickshaws in Chennai. But if you look at other cities of Tamil Nadu, like Coimbatore, Madurai, etc., there are also a significant number of private buses. Now, all of these are in a difficult situation to start with. Also, we need to figure out how they might start operations and start safe operations. So do you have any thoughts, Mr. Yadav, on what can be done, because what can be done with informal transit services as well as private buses to ensure COVID safe transportation? And if you think that the government of Tamil Nadu might have a support system for these service providers. One of the suggestions which has also come from the audience, the participants, is can these buses be hired by STUs so that they can provide COVID safe services both right now but also in the future?
Very, very, very difficult question to answer. As regards integrating paratransit to the overall public transportation system, it will require definitely a lot of work and planning. Basically, in Tamil Nadu, my responsibility is only of running the buses. Then regulation of the permits and so many other issues related to other modes of transport is something looked after by the Home Department and the Transport Commissioner. So we are ready for it. We will not mind it. We'll rather accept it, and I had been also proposing. So we'll have to work on this, but then I don't think that immediately it can happen. And as Mr. Kunal had said, I don't foresee that the government's coming immediately to support any paratransit or private transport system when the government transport system itself are in have a bit of their own financial, like a hell lot of their own financial woes. And coming to hiring of the public transport, as and when the things open up and more movement starts happening and then the demand starts, definitely we will look at that. Like, I think that response will be automatic if physical distancing norms have to be followed, and then a sufficient city capacity is not available, and there is still demand for the public transport. We'll have to look at the alternate models. So contracting those, definitely yes, will happen.
Yeah, as in, just to put it in context, in Chennai, while MTC might have about 35 lakh passengers, or used to have 35 lakh passengers every day, 3.5 million every day, share auto rickshaws also did about 1.5 million lakh trips, or 1.5 million trips every day in Chennai alone. And in other cities, more than half the trips are by private buses or share auto rickshaws of Tamil Nadu. And if you go to the northern Indian cities, nearly 100% of all trips are by share modes or private buses, which presently do not have any public support. So I think a big question would be, again and again, the question of finance and how do we make sure that we support. In this context, like London has increased its congestion price, and many cities were talking about these alternate finance sources to support. Do you think that a state policy could be created? And I would also ask the same question of Ms. Shikha, and then while she is presently the head of a bus operating company, she's also part of the state government administration, and therefore, both of you, I wonder if you think how easy is it right now at this moment to initiate steps to dissuade the use of private motor vehicles, especially in a situation where they potentially might increase. And also partly because the capacity of public transportation is going to be limited in the coming days. So what can be done about it? And maybe another question which has come from the audience is about the question of bus priority lanes. Bangalore already started bus priority lanes, and before the roads again get choked, can we initiate bus priority lanes across our cities, and what can be done about it? And so this question is to both to you and also Ms. Shikha.
So coming back to the taxing, yes, it's a very viable thing, and then the government should be also definitely looking at it. But then I had been proposing this to our finance department, and we had been talking also almost to the private vehicle manufacturers, all the OEMs in Tamil Nadu. We almost pay more than 5,000 crores annually as in various forms of subsidies and concessions. So that itself is given to the public transport department, bus department. I think that's good enough. And the amount of money which goes into the like so many other things can be, and we ourselves end up paying a lot of taxes, from the GST to the cess on diesel and other things and all. So those are the things. So we had been looking at all those things. We had been talking to the finance department, but then this gets like, see, the somebody who does not have an entire perspective of the public transport and imperatives of it may not really appreciate such kind of an idea, that okay, why to discuss personal transport, or like these OEMs and other things needs large concessions because they have to, they do provide employment to so many people. But then simultaneously there are issues of congestion on the roads, then pollution and so many other things. So those also needs to be addressed. So it's a two-way thing, but there is a lot of convincing and dialogue which is required to convince everybody to go into that thing. So, but then yes, definitely public transport in Tamil Nadu is becoming a priority for the government, and still some perspectives need to be clear. Probably this will come into the force. Regarding BRTS also, we have had a study, and almost for 216 kilometers or so, that DPR is ready. Now I got 2 days back, and again I'm pushing with the government to work on this, along with the bus priority lane, which ITDP has given some suggestions on this, our OMR route. So we are pushing that, and that's the only way out. I will say that whatever way we have to push to see that this happens. If we have dedicated bus lanes as a continuous program of the government over a period of time, we don't require metro, CMRL, or the Bangalore Metro Rail or these things, because we definitely at 1/6 of the same cost, we can carry more number of passengers at a much faster rate. Right? Maybe there will be some variations here and there and some issues here and there. And I don't say that one mode of transport should be there and should not be there. But then this is much more efficient and cost-effective mode of transport. And it should be part of the government plan to every year. If we say that we want to do 100 kilometers of metro rail, or whatever, like 50 kilometers of metro rail, we should also do 200 kilometers of BRTS. So that thing has to come as a part of planning.
Sure.
And we are pushing for it, and this will happen in the government. Definitely in Tamil Nadu it will happen. Karnataka is already having already implemented this BRT bus priority lane. So I think southern states definitely yes.
Sure. Over to you.
Shreya, let me add one point for Ms. Shika, because there was also a question about the access of people to digital solutions. Ms. Shika mentioned that this is very important to have better digital solutions, especially if you want to know which bus is already crowded. And there was a question: is enough? Do enough people have access to these solutions in Bangalore, so that is really effective?
Yes, and that was a key question which was asked by our audience. Thanks for pointing that out. That digital solutions are great, but maybe they're not accessible for all. How do we ensure that digital technology doesn't mean making systems exclusive rather than inclusive? And I'd like to ask the same question after Ms. Shika, also of Mr. Sandeep Raizada, who's there from DIMS with us in place of Mr. C.K. Goyal. After you, Ms. Shika.
So coming to the first question regarding the financing for STUs, what could be done? So now I feel is a very ripe time to implement and give some teeth to the acts like UMTA and BMLTA. For example, in Bangalore itself, the BMLTA is in the process of getting finalized. So if mechanisms like congestion fees and parking fees, FRA-based norms, even diesel cess for that matter are considered, then there would be that would be enough to take care of BGF needs of all the STUs. So now is the right time to take care of BMLTA and implement it aggressively. Coming to bus priority lane, we have already implemented our first one. The major challenge we faced there was the implementation issue, enforcement issue. Enforcement was an issue because all the other four-wheelers and two-wheelers kept encroaching upon the bus priority lane. And now we are making a coordinated effort with the traffic police to come up with some kind of automated generation of challan mechanism where challans could be generated and issued to violators. So that implementation has to start shortly. Today we have put our claim on our bus priority lane and started operating there. Third question, coming to digital gap being there, yes, I agree. Digital gap is very much there. Though the number of people who are having smartphones is also quite huge. And now that people are using it for their grocery purchase by way of using their Paytm, Google Pay, we've thought that it is a short term, but obviously the QR code is a very short term gap filling kind of mechanism. Digital payment is the only way where we can ensure total contactless kind of transaction. But as correctly pointed out, for this digital gap, we have also provided for daily passes. Now, I also read one question there saying that the digital passes may not be affordable for all. And we agree, but we have not, state government has consciously decided and we have not gone in for any kind of fare hike. Though some states have taken a decision and increased their fares by 1.5 to 2 times, but we have continued with our existing pass rates. We have not gone to increase that, but still there have been various feedback received that people are finding even that 70 rupees of daily pass to be slightly costly. We are having a look at it and trying to resolve it. As I said already, that this period of 18th May till 31st May is also a restricted phase where buses have been allowed to operate in a restricted way. So our first priority was to ensure that minimum contact is there. But at the same time, we are aware of the issues which people are facing, and we will try to resolve it shortly.
Thanks a lot. Over to you, Mr. Sandeep Rajada. You might have to unmute yourself.
Yeah, good afternoon. Yeah, in fact, this is really a time, I mean, the need of the hour to go digital in all the way for the payment, for the, I mean, the tracking of the buses, or for the availability of seats. Well said. Ms. Shikha said, as Ms. Shikha said, that there has to be an app or something like that a passenger can get an information regarding availability of seats. This is the big question in this post-lockdown era, that we are, I mean, we are very much short in the supply side. The passengers, we were carrying about 3.5 million passengers by bus. I mean, if we include the DTC and the DIMS buses, apart from the metro, which is carrying around 3.5 million, again on a daily ridership. And now the metro is not there. All the offices in Delhi have been opened from today, and the buses are operating with the 50% seating capacity only. I mean, in that way, only we are on the supply side, only 20% seats are being, I mean, we are able to present to the, I mean, passengers. Though it is the first day, so the passengers are not there on the road, but it is going to be challenging. But for this, digitalization is the only way. I mean, they can get the information, and for this, DIMS has already, I mean, an app, show app, where you can get an information about the availability of the seats on that. So this is the only way. We are having the digital payment system, digital ticketing, and we are going for the QR code option also very soon. And yes, this is the only way. Thanks.
Thanks a lot. And as an operator, you come under the Delhi government. Do you have a certain requirement of the government about how to offset your costs? Because you will go under without support.
Yeah, in fact, Delhi is a different story. Delhi government, I mean, they have a budget for all the public transport. They're supporting from all through to the DTC and the cluster operation. This is owned by the, I mean, through the government of Delhi only. Yeah. They are having they are bearing the viability gap of all these expenses. So this is, I mean, different story for a Delhi to the other part of India.
Sure. Thank you. So we're already at 90 minutes. We have many more questions, but what we'd like to say is that, we have all your questions, and we will make sure that this series, it's an ongoing series, and especially on issues which are extremely important to you, the participants, we will make sure that we have other sessions that will address your questions. We're taking your questions and your suggestions very seriously, and we'll make sure that this platform, Urbanlogs, provides those answers, or at least tries to find those answers as we go forward, to make sure that our transportation systems are COVID safe, that people have mobility as lockdown opens up, and again, we become an economically vibrant society for all, not just for a few. So we make sure that whatever happens in the future is equitable. So I'd like to close this session right now at 90 minutes. I'd like to thank everyone who joined today as speakers and panelists. Once again, thanks a lot to the Smart Cities Mission for co-hosting this and allowing such a massive platform to exist for cities and citizens to work together to find solutions. So thanks a lot. Before we close, we have a small little poll about today's session. So please do vote on this poll, and do join us again. Over to you, Archana, about the upcoming program.
Thank you, everyone.
Let me thank you. As co-moderator, let me also say thank you, and thank you to Shreya for the fantastic moderation.
Thanks. Thank you so much, Jürgen.
Thank you, esteemed speakers, panelists, and participants for joining today. We're just waiting for, I can see all of you answering the polls that's launched on your screen. Speakers and panelists, if you also have thoughts and feedback, do let us know. Participants, I can see the number rising. We'll wait for another 2 to 3 minutes while you all fill in your responses before we all log off. Yeah. So while you're all filling up the poll, I like to tell you that all these answers will help us design the upcoming sessions better. We have a very exciting lineup of conversations for you. Our next episode focuses on instant street interventions to expand space for walking and cycling. I'll just take a minute to quickly, sorry, just give me a minute. Yeah, so I just quickly take a minute to share my screen. Yeah, so this is what our next episode is about: instant street interventions to expand space for cycling and walking. It's going to happen next Tuesday on 26th May at 3 p.m. So we'll send you more information via emails and WhatsApp. So stay tuned and stay safe. And yeah, have a lovely day, everyone. I can see the numbers.
Next week, please join us again. And if you think there are others you know who might benefit from this conversation, or would really like to have, give some suggestions for this, please invite them to be a part of this conversation, this ongoing conversation that we have, which is the Urban Dialogue or the Urbanlogue. So thanks a lot, and wish you all a good day. Stay safe, and let's hope that we will come out of this phase fairly soon. Thank you all.
Thank you, everyone.
Thank you.
Thank you all. Thank you.
Thank you. It was great.